Have you come across any of your relative who has having knee problem? He went for the knee replacement, and later on evaluation, the cardiologist is saying that you are having severe block and need to be fixed first before going for knee replacement. And you are surprised that he is not having any of the symptoms previously, and how he can have two major blocks. And if it is blocked, why your patient was not having symptom? So is it possible that block can be there and patient will be asymptomatic or no symptoms? Yes, it is possible. And let us know how it can happen. Hi everybody, I am Dr. Ashutosh Kumar. I am an interventional cardiologist cum electrophysiologist. I did my MD from Banaras Hindu University and DM from IPGMR, Kolkata. I am presently working as a clinical director of cardiac electrophysiology at Care Hospital, Hyderabad, and I am available at Aditya Hridayam Heart Clinic, Manikonda, Hyderabad. This channel is dedicated for awareness regarding the heart disease and its symptom for the general public, and it is a campaign to diffuse the misinformation and disinformation related to cardiac symptoms and management. Today we are going to discuss regarding our case, silent coronary block. Means the patient who is having severe block but he is not having any symptom. He has went for some other reason and he was found to have coronary block. So what exactly is silent block? So coming to the silent block, some patients of severe coronary artery disease can have blocks in the coronaries, or we can say the vessels which supply the heart may be choked, but they may not be having symptom. Why it is happening and why the patient is not having symptom? So let us understand regarding the disease per se first before going deep inside this patient. So atherosclerosis is the disease in which it is a systemic disease in which any vessels can be involved, any major vessel can be involved. If it involves the coronaries, or we can say heart vessel, we call as a coronary artery disease. If it involves the brain vessel, we call it as a cerebrovascular disease. If it involves the renal vessel or kidney vessel, we call it a renovascular disease. The disease is same. The manifestation is also same. The blocks will be happening over time. The progression will be slowly over the course, and sometimes it may get choked all of a sudden, when we call as an acute coronary syndrome. Means all of a sudden one vessel is blocked and the patient will be getting severe chest pain or the symptom of the particular vessel. And this is the we call as a heart attack, for which the patient reach to the hospital and we say that yes, the vessel is blocked, and we immediately take care. So these stories are different. We are discussing today regarding one patient who has come to us with coronary block, and his presentation is of knee joint pain for which he want replacement. And as a surprise, patient was surprised that he is having so many blocks, but he is not having any reason that how he was asymptomatic for a so long period, that all the two vessels has been blocked and he is not having symptom. Now coming to the atherosclerosis when it affects the coronary artery disease. So let us understand what happens when coronary is being compromised, the circulation is being compromised. The patient develop a typical complaint we call as an angina. That is the sensation of heaviness in the chest, or we can say chest pain, which is coming on the activity and relieving on rest. This is a very typical complaint. Somebody is pressing your chest and the sensation of the same thing is going the arm and sometimes below up to the abdomen, and up to jaw it can go. And this sensation is when he will be walking, it will come, and the time he is taking rest, it will reduce. So it is called angina. So angina is one of the typical and very specific complaint of heart symptoms when the coronaries is being blocked. Now coming to this patient who is having coronary artery disease, two vessel has been totally blocked, for which he has underwent stenting. Why he was not having this symptom? So let us understand the behavior of coronary artery when it is being affected by atherosclerosis, which is the local manifestation of this vascular inflammation. So when the inflammation, or we can say atherosclerosis, is set up, at the same time the collateral circulation also get activated, or you can say the growth of collateral circulation also take place. And what happens when a particular coronary is being blocked, there is a sprouting of the collateral vessels from the same vessel or from the branch which is healthy, and that provides the nourishment to the disease artery territory. So if this territory has been totally blocked, as you can see in the angiography also, the blocked vessel will be bridged with the collateral circulation, and the patient may get partially or completely asymptomatic even in the presence of block. So collateral circulation is one of the mechanism God has gifted to the heart, that in situation of slowly progressive block, it can compensate the nourishment of the blocked area by providing the natural bypass. So it is a form of a natural bypass which a few patients develop. Secondly, this collateral circulations can be visible and may not be visible on angiography. So if it is a big one, means the collaterals are big one in diameter, it may be visible on the coronaries, and even your doctor will say, yeah, he is having a good number of collateral, that's why he is asymptomatic. But it may be possible that resolution of coronary angiography may be low, or it may not be able to detect if it is less than 500 microns. So in that situation, it may be present, but we can say the blindness of coronary angiography to visualize this collateral circulation. In summary, this patient who has presented with knee problem, having a severe knee problem, he was not able to walk properly, was having some collateral circulations as an underpinning for his not having the chest pain. And if the patient is developing coronary blocks slowly progressive, if the at the same time he can have the collateral circulation develop from the same vessel, and it may provide the nourishment for the myocardium which has been compromised with the blocked vessels. And that's why it is not mandatory that all the patient will be having the symptom of angina or chest pain if the disease is progressing very slow. So and secondly, if the patient is having knee problem which is compromising his ambulation or his walking capacity, the symptom may not surface, it may remain occult, and that's why elderly patient who is having knee problem, they do not walk so frequently, and that's why, and they are not stressing too much their coronary circulation also, and that's why they may not be symptomatic, or they may be hiding those symptoms of mild discomfort. And that is the reason this patient who is having two vessels blocked is still not having any chest pain. So silent block are possible, and silent block can be possible in a patient with severe coronary blocks. Thanks for watching, and if you find it is informative, please post your comment in the comment box. And if you want to know more about the heart disease and its symptom, kindly subscribe this channel. Thank you.